So what is pain? I think most of us sometime in our life will have experienced pain, and I think we can all agree that for the most part pain's an uncomfortable and unpleasant physical feeling as well as an emotional experience. It's usually caused by an injury or illness in the body, and it sometimes can be a good thing to experience pain because it alerts us to something that may be causing danger or that we may have an illness in the body. But it also could be a source of worry for people, worried that the pain is because something is happening that you don't have control of, or in the context of cancer, it might be that you're worried that your cancer may have come back or something is progressing that you're not sure about. The body is a complex system in terms of how messages are conveyed to the brain. When we experience pain, the nerves in the body send messages to the brain, telling the brain that we need to do something, and then we get a message back, and that's how we feel and experience pain. Pain is also not only a physical feeling. How we experience pain can be affected by how we are feeling emotionally. I think if we're feeling generally quite happy and upbeat about things in general, our experience of pain may not be as bad as when we're feeling quite low emotionally. And I think also the important thing to say about pain and why we're very keen to treat pain as thoroughly as we can is that because uncontrolled pain for a long period of time can have a major impact on our emotions and our general mental health and can make us feel quite depressed and debilitated because it can have a profound effect in stopping us doing what we want to do. Assessing pain. I think the one key thing to say about pain is that it's important that we talk about it. I think the worst thing that you can do is to feel that you're being a nuisance, it's just you, or that you shouldn't be mentioning the pain that you're experiencing. The people who are looking after you, whether it's your Macmillan nurse, your consultant, or any other person who's involved in your cancer care, including your GP, will want to know if you have pain so that we can do something about it. The first point that you can do is to help us in helping you is to keep a pain diary. That doesn't have to be anything that's elaborate or fancy. It can be just writing things down on a piece of paper so that you can keep a record about the pain that you're experiencing. If you can note some key things, that will help us help you in diagnosing your pain and working out the best treatment that we can do to make sure that we optimize your pain management. When we ask you about pain, if you can tell us when it occurs, does it occur when you're doing nothing? Is it when you're doing something in particular? For example, when you're getting up and walking around, or any other particular activity that you've recognised that can trigger the pain to start. Where is the pain? I think often people can have more than one pain, so it's important that we try and recognise that where the pain is and what's causing that pain to happen. How bad is the pain? Does it stop you doing things? Does it wake you up at night? Do you have to stop what you're doing? If you stop what you're doing, does the pain then go away? Is it the worst pain that you've had? Secondly, is there anything that we can do, anything that you've done that helps the pain? Does stopping what you're doing help? Have you found that taking simple analgesia like paracetamol helps? If you can note those things down, then when you see your health professional, we've got a record of what you've done to help, and we can see if we can help further. And also importantly, it's to think about what does the pain actually feel like. Pain works in different ways and affects different nerve pathways, and by asking you what the pain feels like, it will help us understand the best treatment for you. Sometimes people find it hard describing pain, but the key things that we look for is it a shooting pain? Is it a stabbing pain? Does it feel like you're having an electric shock and that you've got pain shooting down your arms or your legs, for example? Does it feel like someone's knotting inside or tying a belt around you and tightening it? If you can describe pain in those ways, then that will really help us to help you in managing your pain. Managing pain with painkillers. That's probably the most common way in which we actually manage pain. Giving painkillers by the oral route is probably the most effective way that we can manage your pain. For some people with certain types of illnesses, it might mean that you'll have difficulty taking medicines by mouth. If that's the case, then please don't worry, because there are many other alternative routes that we can use. It might be that we administer medicine through a pain patch, which is similar to a plaster, and the medicine's absorbed through your skin. And for some people, we give medicines as a continuous infusion under the skin. But for most people, we find giving medicines by the oral route is the most appropriate way to give painkillers. It's important that if you are prescribed painkillers, that you take them as they've been prescribed. And the important thing about that is that painkillers last for a particular length of time in the body. So if you've been prescribed painkillers to take twice a day, try and take those at equal time, split out during the day. For example, 8 o'clock in the morning and 8 o'clock at the night. And if it's every 4 hours, then try and take it every 4 hours as well. And when we manage pain, we adopt a step-by-step approach, and all the doses that we give to people are very much individual. So please don't think that just because you have a friend or a colleague or someone that you know who's had the same diagnosis as you, has had the same treatment and has a similar pain, that they're going to have the same analgesia at the same dose. We treat everyone individually, and what might be right for one person may not be right for you. Treating pain is important to get on top of things as early as possible. The body is a complex system in how it manages pain, and people who put up with pain for a long period of time, the brain gets tricked into believing that that pain is something that it will have to live with, and then it becomes more resistant and difficult to treat that pain. So it's really important that we treat pain as early as possible, and it's a lot easier to manage a small pain than it is to manage a pain that's causing you a lot of discomfort. And as I mentioned earlier, there are alternative routes that we can use to giving painkillers. So if managing things by mouth is difficult for you, your health professional will talk to you, and we will think of alternative ways in which we can give you painkillers. Peripheral neuropathy. I'll mention this briefly because not everyone will experience it, but some people who undergo anti-cancer treatment, particularly certain types of chemotherapy, will experience what we call peripheral neuropathy. Not everyone who has chemotherapy will experience this, but it does happen to some people. It's commonly caused by a change in the sensation that you experience, and people will often find that at their peripheries, so sort of their hands, their fingers, their feet and toes, they might notice that they don't feel things as well as they used to, or they might think that the sensation is slightly difficult. Some people will describe it as if you're putting your hands into a bowl of cotton wool. Some people will say it's a very cold sensation, as if you're putting your hands or your feet into a bath of ice cold water. If you do experience these types of pains, there are different types of medications that we can use to manage neuropathic pain. You might find you're being prescribed drugs when you read the packet are commonly prescribed for epilepsy or for depression. But often we've found that certain types of these drugs are very useful in the management of peripheral neuropathy, which is why your health professional will prescribe those if they think it's appropriate. Some myths and worries about pain. The first thing is that everybody gets pain. Not everybody does. There are lots of people who go through their cancer treatment and don't experience any pain. And if you're one of those people, congratulations, and I think that's very good. But there are people that do get pain, and that's why we can do things about it. Another worry that I often hear from people is that they say they're worried that they get addicted to painkillers. If you experience pain, the painkillers block the messages that are going to the brain. So there is no concern that if you're taking strong painkillers appropriately, that you'll actually get addicted to painkillers. The problem is that some people take painkillers when they don't have pain and experience a euphoric effect from having those. But what we do know is that painkillers given to people who do have pain are safe when they're monitored by a health professional and they work well. So please don't worry about that. Another thing I hear is that sometimes people say they save the painkillers for when things get really bad. Please don't do that. There are no bravery medals for this. If you have pain, we can treat it. If the pain does get worse, then we can still treat that. If the pain is bad, we will treat it. Please don't feel that you have to save things up for when things are really, really bad. And the emotional impact of pain, I just can't get over that strong enough, how uncontrolled pain can have a really, really damaging effect on your general well-being and how you feel in your own mental health. If you can't get up because you're in pain, then you can't do the things that you want to do, and that will have a big emotional impact on your general well-being, both on you and those around you. So if we can get on top of your pain and get you feeling better from a pain point of view, then we can maintain your general well-being as well. Common side effects. All medicines have side effects, and there are things that we can do to manage that. I think it's important that if you do have side effects, that you talk about those with the person that's prescribed the medication, and that we can look at either changing to a slightly different medicine that doesn't have those side effects, or that we can manage the side effects in a slightly different way. I think the worst thing that you can do is stop taking the medicine altogether, because that will bring the underlying problem, i.e. the pain, back. The main common side effects that you will experience if you are on strong analgesia are constipation, which we can manage easily with changes to diet or with medicine. Nausea, which is something that people experience sometimes for a short period of time, but if that's persistent, again, that we can manage that as well. And other transient symptoms people experience, sometimes they feel a little bit woozy or out of sorts, but often that's something that only lasts for a day or a day or two at most. And I would encourage people to stick with those symptoms for as long as you can, just to see if we can get on top of those while we try and work out the right pain medicine for you. Non-pharmacological approaches. Managing pain is not just about giving painkillers. Physiotherapy and exercise is an important thing that we can do in management pain. People that are active as much as they can, that helps generally with people's well-being and management of pain. Occupational therapy, they can help with energy conservation techniques or provide equipment so people aren't exerting themselves unnecessarily. Talking therapists can help people talk through concerns about them, and then in that self, that will help people's well-being and help people manage pain generally. Some people find complementary therapies, massage, for example, to be useful. Things like heat pads, distraction techniques can also be useful in managing pain, and managing your own emotions and mental health is really important. Thank you.